everyone, my name is Betty Hernandez, first year college from the SN1B. So now I'm going to demonstrate to you the heart and central vessels assessment by our patients. So first, I'm going to introduce myself to our patient and verify his name. So good day sir, I'm Betty, your student nurse for today, and may I ask what is your name? Okay, so after that, I'm going to assemble all the equipments and the needs that we will be needing. First is our stethoscope and centimeter ruler and disposable gloves if necessary. So now we will proceed in the procedure. First, we need to explain to the client what we're going to do and why it is necessary and how he can cooperate. So the rationale is for the patient awareness in what we're going to do in the procedure. So good day sir, for now I'm going to assess your heart and central vessels. Is that okay to you? Okay. So next we will do the wash hands or observe other infection control procedure or the hand hygiene. So the rationale is for us to avoid the spreading of microorganism or the cross-contamination among patients or clients or vice versa. So next we need to provide for client privacy. For example, close the door or close the curtains. Okay, so now before we start to our procedure, we need to ask to our patient if it is okay to take off his shirt for us to be successful in our procedure that we will be doing. So sir, can you please take off your shirt? Is that okay to you? Okay, after that, I need to ask some few questions to our patients. So, sir, can I ask if you have a family history of heart disease? Are you high cholesterol level? So, sir, do you feel any high blood pressure, stroke, or any heart disease, heart attack? Okay. So now I'm going to inspect and palpate first the aortic and pulmonary areas. Okay, so now I'm going to inspect and palpate the aortic and pulmonary areas. So sir, do you feel any pain as I touch it? Okay. So everything is normal. Everything is normal. There is no any presence of abnormal pulsations or any leaps or hips in the aortic and in the pulmonic areas of our patient. So now I'll proceed inspecting and palpating the tricuspid area of our patient. So sir, I'm going to touch it. So sir, do you feel any pain as I touch it? Okay. So everything is normal with the tricuspid. There is no any pain detected with the patient. So there are no any abnormal pulsation or lifts or hips in the tricuspid area of our patient. So now I'm going to inspect and palpate the apical area of our patient. So sir, do you feel any pain as I touch it? Okay. So everything is normal. No abnormal or any presence of lifts or hips, and there is no abnormal pulsation in the apical area of the patient. So now we're going to, lastly, for the precardium, we're going to inspect and palpate the epigastric area of our patient. So sir, do you feel any pain? Okay, so there are no any abnormal pulsation or lifts and hips detected. Everything in the precardium is normal. No any abnormalities of the pulsation on the lifts or any hips detected on our patient. So now we're going to auscultate the heart in all four anatomic sites, which are the aortic, pulmonic, tricuspid, and the apical or mitral area. So So based on my patient, everything is normal. The sound, no difficulty of breathing, and everything is normal. And now we will proceed in palpating and inspecting on auscultating the carotid artery. So sir, I will touch your neck. Is that okay to you? Sir, do you feel any pain as I touch it? Alright. So sir, can you please inhale? Exhale. Okay, so sir, do you feel any difficulty in breathing? Okay. So the carotid arteries is normal, no any abnormal findings detected with our patient. So now we're going to everything in the carotid arteries is normal and nothing to worry. So lastly, I will inspect and palpate and as the jugular veins of our patient. So sir, can you please do this? Okay. So sir, I will touch your neck. Is that okay to you? So sir, do you feel any pain as I touch it? Alright. So the jugular veins of our patient is normal. No any pain detected as I touch it. And especially there is no any presence of jugular distension. And so yes, no abnormal findings. So everything in the jugular veins is normal. So after that, I need to document all the data that I've gathered in the patient. So after all the procedure, I need to do the hand hygiene. And yeah. So that's how I demonstrate to you the heart and the central vessels of our patients.